Hello, I'm David Bohnert, Ruminant Nutritionist and Extension Beef Cattle Specialist with Oregon State University and the Eastern Oregon Agricultural Research Center, and I'm here to present an Eastern Oregon Ag Minute. It's calving season, and one of the most critical times of the year for any cow-calf operation. Management during this phase of production must be the best. Any dead calf is an automatic loss of approximately $400 or $500. In addition, any calf that gets sick in the first 45 days of life will weigh 35 to 45 pounds less at weaning than a calf that doesn't get sick. This can translate to a loss of $40 to $50 per sick calf when the reduced weaning weight and medical costs are added together. Consequently, producers must strive to get calves here alive, and keep them healthy. It sounds straightforward, but it is often a challenge. The major causes of young calf death or illness are calving difficulty, starvation, hypothermia or cold stress, metabolic disorders, scours and pneumonia, and trauma. Most of these causes can be prevented or reduced with good calving management. Exposure to cold and precipitation can kill newborn calves rapidly. A study of 87,285 calves born at Clay Center, Nebraska demonstrated that even without rain or snow, the percentage of calves that die to exposure increases rapidly when the temperature is below 50 degrees. Rain and snow just make the problem worse. This is even more important with first calf heifers. In the Clay Center study, calf death loss for first calf heifers was approximately 12% when the temperature was 32 degrees with no precipitation, and 19% with precipitation. Contrast this with calf death loss by mature cows, which was only 3% without and 5% with precipitation at the same temperature. The effects of cold exposure can be minimized if care is taken to ensure that calves nurse soon after birth. In addition, during extremely cold or wet conditions, calves may need shelter for the first 24 to 48 hours of life. Chilled calves should be brought into the calving shed for warming and assistance in nursing if necessary. Extra attention to newborn calves during bad weather, especially calves of first calf heifers, can pay big dividends. Calf scours is the most common symptom of illness in young calves, and it can cause a large financial loss to cow-calf producers. Scours can be caused by several different viruses, bacteria, and/or organisms. When a calf is affected, it can lose large amounts of fluids and is quickly dehydrated. This is critical because a baby calf is approximately 70% water. Death loss because of scours can be upwards of 50% in severe cases. So what can you do to reduce the occurrence of scours? Current recommendations include vaccinating the cow herd prior to the calving season, calve heifers in a separate area from older cows, avoid calving on wet and or muddy ground, provide portable calving shelters to keep calves dry and protected from the wind, make sure newborns receive adequate colostrum, isolate scouring calves and treat immediately, and turn pairs out to new pasture as soon as possible. Most all cow-calf producers have to deal with scours, calf scours that is. So when should calves be treated? Calves running around the pasture with their tails in the air, bucking and kicking with yellow or white diarrhea may not need treatment. The main indications for treatment are if the calf is weak, depressed, not eating, dehydrated, or reluctant to move. Dehydration is the most common result of scours. Consequently, the primary treatment is fluid therapy. Secondary treatments are antibiotics and nursing care. The first course of fluid therapy is oral electrolyte solutions. The use of electrolytes, not water, allows the calf to absorb the water they need from its digestive tract. Giving straight water does not work. In severe cases of dehydration, fluids need to be given intravenously or intraperitoneally. Be sure and consult your veterinarian regarding the appropriate electrolyte products for your operation. Other management options for calves with scours include isolating sick calves from healthy calves, providing shelter from the wind, and treating sick calves after you have attended to all normal calves. This will help decrease the spread of the disease. Use of growth-promoting implants in calves at branding has been proven to significantly enhance average daily gain between branding and weaning. thereby improving the profitability of ranching operations. Average daily gain is normally increased by about 1/10 of a pound a day, or a total of 15 pounds from branding to weaning compared with non-implanted calves. The question then is if the additional pounds of calf at weaning make up for the cost of the implant and associated labor. An implant and labor will probably cost about $1 per head if the calves are implanted at branding, when calves are normally worked and vaccinated anyway. The additional 15 pounds of calf has been worth at least $15 the last few years. Therefore, the added revenue to the cow-calf producer, less the cost of the implant, is approximately $14 per calf. Recommendations to follow if you choose to implant calves include following all label instructions, implant calves at branding to get the most use out of the calf foot implant, do not implant future replacement heifers or bull calves intended to be used as herd sires, and be aware that the use of growth-promoting implants will not allow you to sell calves to any natural or organic beef marketing program. I'm David Bohnert. Thanks for listening.